Importance of patient safety and safe surgery. Patient safety is a key feature of primary healthcare service, including dentistry, encompassing strategies, protocols, and guidelines to ensure the well-being and protection of patients during dental procedures. Patient safety is considered a quality dimension. It's defined as the reduction of risk of unnecessary harm associated with healthcare to an acceptable minimum. It, it's estimated that unintentional harm, known as an adverse event, occurs from 2 to 3% of the times that patients attend primary care service. Since 2012, the WHO has recognized adverse events as a public health problem. In dental schools, incorporating a patient safety culture prepares students for their future roles as a dental practitioners. The eight essential actions for patient safety. Patient identification. The purpose is improving the patient identification accuracy by using at least two pieces of information to prevent errors involving a wrong patient. The patient full name and date of birth. Effective communication. Improve communication between health professionals, patients, and their family members in order to obtain correct, timely, and complete information during the care process. The informed consent is mandatory and must be included in the medical record. Safety in medication process. The dentist must strengthen actions related to the storage, prescription, transcription, dispensing, and administration of medicaments to prevent errors that could be harm patients. In dentistry, unintentional damage derived from medication errors has focused on reporting the systemic consequences after the administration of local anesthesia, sedation, and general anesthesia, which include cardiovascular events, allergic reactions, and even death of the patient. Safety in procedures. The purpose is this essential action is reinforcing safety practices internationally accepted and reducing adverse events to avoid sentinel events derived from surgical practice and high-risk procedures outside the operating room. Risk reduction of healthcare associated infections. This action aims to minimize occurrence by implementing a comprehensive hand hygiene program during care process. Patient risk reduction to falls is to prevent patients harm associated with falls in healthcare settings, recording and analysis of sentinel events, adverse events, and near miss. Incident and adverse event reporting systems provide information about the events leading to the adverse event, generates information on near miss, adverse events, and sentinel events through a recording tool that allows analysis and favors decision making to prevent their occurrence at local level. Patient safety culture. It's defined as a product of individual and collective values, attitudes, perceptions, competence, and pattern of behavior that determine the commitment to health and safety management in the organization, as well as a style and competence of such management. Surgical checklist in dentistry. This list aims to strengthen establish safety practice and encourage communication and teamwork to improve safety in surgeries and reduce the number of the complications and unnecessary surgical deaths. Before the surgery, corroborate patient data allergies, review procedures to perform X-rays, identify area of surgery, review medication, medical alerts, complete material. After the surgery, check that no material remain in his surgical area, give post-operative indication, confirm the labeling of anatomopathological samples obtained. The development of checklists in surgery oral will identify and evaluate factors systemic, clinical, and radiographic associated with surgical difficulty in oral surgery. Planning techniques. One error in the area to intervene. Prevent damage to adjacent structures and the identical or incomplete interpretation of clinical history. Establish correct protocols, preparatory antibiotic prophylaxis, and minimize extend surgical time. Tissue trauma and infection requires the error in prescription. It will reinforce the commitment to inform one and follow patients. Thank you.